Good evening. Hi everyone who is joining. I am being joined by Vios Fertility Institute tonight, or today, this afternoon, and we're going to talk about everything to do with fertility, lifestyle and weight, which I know many readers have had questions around before. We're being joined by two of the leading experts from Vios Fertility. So I can see them here now. I'm going to invite them into the room. Good evening or good afternoon. How are you?
I'm doing really well, thank you.
Oh, nice to be speaking to you in person. I
Hi.
was just introducing Vios Fertility Institute, but please could you introduce yourself? And I'm gonna invite Dr. Hayes in now.
I am Dr. Violet Klenov. I'm one of the board-certified reproductive endocrinology and infertility specialists at Vios Fertility Institute in St. Louis. I love talking about weight, lifestyle, anything you can do to modify chances for natural conception or with treatment. So thank you so much for having me.
It's a great topic and it's lovely to have you both here. Welcome.
Hi, thanks for
Hi.
having us. Nice to meet you.
You too. Please could you give those who are watching an introduction to yourself and a little bit more about Vios Fertility?
Well, I'm Dr. Ellen Hayes, and I am one of Vios Fertility's physicians in the Milwaukee, Wisconsin area, joined with my lovely St. Louis partner, Violet Klenov, and she and I really enjoy talking about fertility and wellness. So at Vios Fertility, we take care of all aspects of fertility care, fertility treatment, but we also like to kind of look at the whole patient and really dive into overall health and ways to optimize outcomes with treatment or even natural conception by making lifestyle changes. Violet and I head up the Fertility Wellness Center of Excellence at Vios Fertility, so we're really interested in this topic.
I know that you have a fantastic holistic approach, and that's something that was of huge interest to me when I was going through IVF. I really think that as you would say, there's so much that can be done to support yourself holistically, can't there, when you're going through such a stressful time? Can I ask you a couple of questions that we've had sent in, and then if anyone watching wants to ask, please feel free and please comment away. So in terms of lifestyle and weight for fertility, let's start with weight, because I know it's a bit of a controversial subject in terms of BMI. Do you feel, or is there evidence that being overweight can negatively impact fertility and IVF success?
Violet, do you want to take that one?
Yeah, absolutely. So although BMI or body mass index is not a perfect measure of health by any means, nor is your weight in isolation a good estimator of that either. For the purposes of epidemiological studies, a lot of studies do look at BMI, groups and how does that impact, or how is it associated with chance for success with natural conception, or specifically with IVF. And we do see a clear trend towards a reduced chance for success, predominantly live birth, the outcome of interest for all of our reproductive studies, with increasing BMI. Similarly, we see a reduction in success when we are below normal BMI, healthy BMI ranges as well. So there is a sweet spot, and it's probably somewhere, 20, 25, 19 to 25, something like that. And then with increasing BMI into the 30, 35, and 40 or above, we certainly do see an association with reduced chances for live birth with IVF treatment and increased risk for miscarriage as well.
So when you see people who might have a higher BMI, do you recommend that they lose a bit of weight before they start, say, a cycle of IVF?
So we address each patient individually and say, kind of, here's where you are, and is this an accurate assessment? Maybe we have a weightlifter and her BMI is elevated because of her muscle mass, but for the most part, BMI is elevated generally because of increased body fat rather than increased muscle mass. Gosh, wouldn't that be lovely? But we do. So we have a discussion, and it kind of centers on how can you become as healthy as you can be ahead of pregnancy, ahead of treatment, to then make you as healthy as you can be during pregnancy for your own health as well as for the health of the baby. And, then we can discuss what types of things we recommend, but we certainly bring that up in terms of, hey, here's where you're at. Here's what's associated with this specific body mass index according to the literature, and how can we help you get to your personal goal? What have you been through in the past? What's been successful for you? Do you feel like you're doing well? Do you feel like your diet is optimal? What's your exercise regimen? Kind of go through all those things on a patient by patient basis.
Mm-hmm. And Dr. Hayes, what's your take on it?
Yeah, I like that we want patients to understand maybe the potential impacts of their personal health on their personal success rates. But I like the way that Violet phrased, BMI is not the whole picture for any patient.
Mm-hmm.
So what I like to talk about is not only, how BMI can potentially negatively impact outcome. We know that women of all sizes get pregnant and carry pregnancies. So I also like to touch on really more specific points like nutrition, like exercise, things that can also positively impact chance for pregnancy and live birth rates, and don't necessarily mean losing large amounts of weight or gaining large amounts of weight if we're talking about underweight patients. Yeah. But, nutrition and exercise and just overall improvement in general health can impact things positively and are really important too. I will say, though, that I always hope that the OBGYNs will talk to their patients who have a little higher BMI, because there are some safety measures that come into play for certain types of treatment. So, for instance, if women want to do IVF, in order for us to retrieve their eggs, obviously we don't want them to be awake. We want them under sedation so they're comfortable and it's not a painful process at all. But there are BMI limits that we have to set to make sure they can tolerate the anesthesia safely. So some of those things have a medical reason where we just want everyone to be able to get through fertility treatment safely. But we also want to factor in things like, is this patient older? Does she have a low ovarian reserve? Do we have the luxury of a lot of time for her to go and lose weight and get into an ideal BMI category versus do we want to talk more about moving more quickly?
In terms of improvement for egg and sperm quality, I'm sure there are things that people are already actively doing, but when someone comes to you for fertility treatment, or you're suggesting that they continue to try to conceive naturally, what are the first things that you would suggest that they look at changing about their lifestyle, obviously dependent on their personal situation?
Mm-hmm. Yeah, that's a great big question. So we look at that patient individually, see where are they at, what's their story, what is their physical exam, what is their weight, how do they feel about their current lifestyle, what kind of diet are they consuming for the most part. Are they getting exercise? How's their sleep? How's their mental health? Kind of all of those things as a package. And I always like to think about these things, these modifiable risk factors that we all love discussing. It's not as though one thing makes or breaks it. Like you're stressed out. That's not why your fertility treatment's not going to work. You are a couple pounds overweight. That's not why your fertility. But some of these things, I think, where we all want to support our patients is that there's not a lot of things in your control as a patient. So these modifiable factors, how much sleep I get, which is debatable, I guess, modifiably. Your diet, lifestyle, exercise, mental health, how much time you take to care for yourself, are somewhat modifiable. And I think of them as all contributing like little percentages. And because there's so many of these modifiable things, toxin exposure, that if you do your best to attack each one of them, maybe you will see an improvement overall in terms of your success, certainly with the weight and becoming healthier ahead of treatment. But, there's certainly some low-hanging fruit that Dr. Hayes and I discuss all the time. So just straight limiting toxin exposure. So how much alcohol are you drinking? For women, we recommend less than 1 drink a day, probably like less than 2 to 3 a week on average. For men, definitely less than 2 drinks a day, avoiding clear toxins such as tobacco. Marijuana use has been shown to negatively impact semen parameters, and more we're learning that perhaps it's also negatively impacting ovarian and egg quality. So I'd say those are the easiest things to tackle right now if you're not already doing. How many preservative-rich foods are in your diet? You know, how many chemicals are in the things that you're eating and drinking, you know, that you can't pronounce, that may be inflammatory to your body, may be inflammatory to eggs and sperm? Is your consumption of fresh fruits, fresh vegetables? What kind of protein are you getting? And then kind of looking at daily exercise, we'd love to see at least 30 minutes a day of, cardiovascular exercise. How's your sleep? We'd love for you to have at least 7 hours of sleep every night. Kind of addressing some of those bigger and easier things, and it can't be all at once. So I think give yourself some grace and tackle some things one at a time. And work your way up to the things that are more challenging for people, like being more stringent with a focus on the types of diets that are associated with improved outcomes with fertility treatment, which I'm sure we'll get to. But if you're, smoking, you have a high alcohol intake, you need some help, mental health perspective, attack those things first. See what's easiest for you. Just start getting some of those things done and then work your way up to, perfection. But we can't all shoot for perfection on day one.
I guess it's difficult, isn't it, with the unknown of not knowing how long that journey might take, thinking, I feel like I'm cutting so much out of my life for a period of time we don't know how long it will be. So I guess it is doing those things, isn't it? But also allowing yourself to not beat yourself up if you eat a bit of dark chocolate, which you've been trying not to have sugar, or have that one glass of wine and then decide that it's not going to work before that, obviously in moderation. But there is a balance, isn't there, between kind of making yourself too stressed because you're looking at every single toxin in a nail polish or having your hair down or things like that, and then looking at things that actually we know play a role in it.
Yeah, I think that's an excellent point. I think, like Violet mentioned, these can all have an impact, but there's nothing that's going to be make or break. There's no perfection when it comes to wellness. And I think that you can really up your stress level if you think you need to be perfect in every category all the time. And we know that that's absolutely not true. These are just things to work on. You don't have to blow up your whole life, everything about it, diet, exercise, toxins, all of those things you could really kind of spend hours and hours thinking about and trying to change lots of things at once, but that's not necessarily important. It's really just educating yourself. And that's why we're here. We want to kind of talk about things like that could be helpful, but not to the point where you make yourself so stressed over them that it's taking over your life. And I think the stress management for anyone going through infertility or fertility treatment is so critical. And I love to talk about it early on because it starts before people even come to see me. So it really takes an effort, I think, to manage stress during fertility treatment. And there's lots of ways to do it, lots of ways that are really beneficial. It's just kind of finding your way and what works for you.
And so thinking about exercise, because I think, if I can find it, someone asked a question earlier about how much exercise is okay. You probably get asked that a lot. What would your recommendation be in terms of exercise leading up to treatment, during treatment, and after treatment?
Yeah, so we definitely encourage women to stay active before treatment, during treatment, and after. There's very few restrictions, and primarily they involve when a woman's undergoing something like IVF and the ovaries get very large. And as ovaries get large with those many eggs growing, they can be at risk for twisting, especially if you're doing something high impact, doing inversions, things like that. So we tell you to be kind of careful and focus your efforts on low impact activity while you're in treatment with something like IVF and ovaries are large. It takes usually about, 2 to 4 weeks for ovaries to get back to normal after an egg retrieval. And once they're back to normal size and you're getting ready, let's say for an embryo transfer, or you've undergone an embryo transfer and you're outside that window when ovaries are at risk, then we say, let's get back to what you were doing before, and if you weren't doing anything before, it's a great opportunity to really slowly start your way into a healthy, sustainable exercise regimen. And that looks different for every woman. You know, if it's been years since you've exercised, you may have some limitations. You have orthopedic issues. You have, you know, a history of injuries. Take it slow, maybe cycling, maybe swimming, some low impact to where you can just build up to get to something where you're at least maybe 30 minutes a day of doing something that makes you feel good, that you take time out for yourself. I have a lot of patients who, let's say, are ultra marathoners. They're used to crazy exercise, you know, and there's good and bad to that. They're extremely fit, but sometimes over exercising can lead to menstrual irregularity and can cause some challenges when we're dealing with infertility treatment. And so the discussion for them, those patients who really use that heavy exercise, it's an outlet. It is a complete stress relief. It's part of their life, and they struggle with the limitations during IVF treatment to not be able to do high impact activity. And then a lot of them will find other alternatives during that time, such as yoga, such as maybe, you know, other body weight resistance things that still get them that outlet without putting ovaries at risk. And then as far as what's safe when you're pregnant, early pregnancy, you know, everybody's a little different. The dogma back in the day was, you know, women are delicate flowers and everybody's on bed rest and you're gonna mess something up. That's really not the case. And more studies are coming out suggesting healthier, more active mom, a healthier baby. Not only at delivery, but further on in life, that your metabolism and what you do to stay active during pregnancy can impact the subsequent health of that baby, even as an adult.
Wow.
So we encourage activity, and the key is just to work your way back up, you know, when you're in pregnancy and maybe you had a lull, you weren't feeling well first trimester, just take it slow, listen to your body, but there's really no restrictions in terms of exercise when you're pregnant. If you were doing it before your body's used to it, you take your time to build your way back up there. It's only going to benefit you and the baby.
Mm-hmm. Now let's talk a bit about supplementation. What are your recommendations in terms of what men and women should take?
Well, I usually start by making sure, obviously, every woman is on a prenatal vitamin. And that's because we can't always forecast when pregnancy will finally occur. And we want to have that folic acid on board to prevent any birth defects, neural tube defects, and cardiac defects in the baby. But also because folic acid has been associated in some studies with better fertility and better live birth rate. So I think, you know, the prenatal vitamin doesn't make you more fertile per se, but it's important. And, you know, having a well-rounded vitamin and good nutrition is important when you're embarking on this. Also for men, you know, I recommend a multivitamin for men because not everyone's diet is perfect as far as vitamins and minerals too. And so I think that's a good place to start. I like the anti-inflammatory properties of an omega-3 supplement for both partners. So a fish oil or algae oil supplement, I usually will kind of say across the board, you know, that's not a bad idea for both partners. And vitamin D, you know, we check vitamin D in the female partners, basically in everyone. We don't always check it in the male partner. And so much of our population, you know, especially where I am in Wisconsin, where it's cold a lot of the year, you're not in the sun, but really kind of across the board, people are vitamin D deficient. And so you're not going to hurt yourself by taking 2,000 IUs of vitamin D a day for men and women. And then sometimes women will ask them to take more than that if they're deficient in vitamin D by blood test.
Someone just asked about a transfer. This is slightly off topic, but not working, finding out, I guess, at 10 days post-transfer. It obviously depends on the person's protocol, doesn't it? It's difficult for you to answer why a cycle might not have worked. What would be your suggestion to speak to their team to get some answers?
Mm-hmm. Yeah, anytime we have an outcome that's negative, it's important to talk to your physician about why do we think this happened? You know, what was the grade and quality of my embryo? How did my lining look? Is there anything we can do differently next time? They're not easy conversations to have, but at the end of the day, even in a best case scenario, it's not 100% chance for success. And you may not learn the reason for why that embryo didn't succeed. And the unknowns in terms of what you encounter in treatment are the most challenging things, I think. I think most of us are used to having control, and which is part of the reason we're having this discussion. What can I do to improve my chances? What can I take? How can I exercise? Our patients are just hoop through hoop. They'll do it all. And no matter how hard they're working, sometimes, you got a 50-50 shot and you're just on the other side of the 8 ball for that. And your doctor should review with you to make sure that everything looked great, make sure there's nothing to optimize, and to change for next time if needed. And then unfortunately, sometimes we just don't know.
Yeah.
And for you both as doctors, do some cycles surprise you and others have different outcomes than you may have expected? Is it hard to predict what's going to happen for each patient?
Yeah, I'm shocked every day.
Predict every single scenario because we're dealing with human beings and the human body, and a lot of it is still having to happen within the body. And we wish that we could see and give our patients an answer to every negative pregnancy test, but we often can't. And sometimes it's really a matter of just trying again, maybe not even making big sweeping changes. But I do think it's very important that if you're questioning why aren't things working, that you're talking to your doctor about that. We don't want people wondering. We definitely don't want people stopping treatment because they're confused and upset. So at Vios, we always have follow-up visits planned at every step of the way for our patients. And if you don't feel like you're getting that with your clinic, ask for it. And if it's not happening, then get a second opinion. We have 9 amazing physicians at Vios across the Midwest and now in Portland, Oregon, and we all do virtual consults, and we're happy to review your history and let you know what we think so you feel like you're being heard.
And as you said, you see patients from all over America and all over the world, don't you? So things can be quite accessible, can't they, with the way that you can consult online, etc.
Yeah, it's very nice.
I actually posted a podcast today with someone I was doing. I did a podcast with where she talks about, being her own advocate and changing fertility clinics, just not having the right feel and therefore looking for a second opinion and looking for the right fit. And that's so important, isn't it, for a patient?
Yeah, absolutely. And if we don't know the answer, I mean, so much in our field, it's a beautiful field, but it's evolving and we're learning new things every day. And, part of the reason Dr. Hayes and I love being at Vios is that we're ahead of the curve, in terms of technology. And it's our job to stay aware of recent publications, know what's going on. And there's not always a clear answer. There may be some small studies that show promise. Maybe there's no big trial. And it's our job to help sift through those things with you and say, okay, first let's do no harm. But if there's a chance that something can help, here's the pros, here's the cons, here's what's known about it, here's what isn't, what feels right to you. And sometimes it may be nothing. And sometimes it may be trying something new, as long as you know what you're getting yourself into. And then you kind of know that we're on your side and kind of helping guide you through that process, because just jumping into this world is overwhelming and you don't know what to believe about X, Y, or Z, and there's studies on everything. So it's our job to help you navigate through that.
Do you find, last question, but do you find that your patients come in quite well read? Do people do a lot of their own research before they come to consults?
I definitely see that quite often, and I love that. And I would actually kind of throw that out there as a suggestion to any men or women going through treatment or even just starting their fertility journey. If you have an appointment with your doctor, write down all of your questions, write them down, for several days as you think of them, and bring them with you to the in-person or the virtual visit, because that's what we're here for. And I love to hear about what people are reading. It helps me to know kind of what the conversations in the community are about, so we can address that and kind of help people know, is this just something passing through social media? Is there merit to this? Is this something we should think about? But I think questions from my patients, that's one of the best parts of the job, is talking about things like that and answering questions.
Fantastic. Well, thank you both so much. I know there are people who've been asking questions about their own individual situations, and I would suggest getting in touch with Vios Fertility, who can arrange a consult for you, and you can have your, personal situation looked at. But thanks everyone for joining, and thank you to you both for a wonderful live.
Thank you so much. It was lots of fun.
Thank you for having us.